As CEO of American Oncology Network, my primary responsibility is to set the strategic direction for our organization. So we have already done this in several states. We have tremendous opportunity to grow American Oncology Network, and most importantly, to keep community oncology alive and well. Many of the practices that have already come into our fold and/or will continue to come into the American Oncology Network have tremendous reputations. But we're going to be able to expand the scope of services that they're able to offer their patients, whether it's from a laboratory standpoint, hematopathology, anatomical pathology, the oral pharmacy, which is world-class pharmacy. We also will offer radiology services if need be, radiation oncology. Very, very important is being able to expand or even add, if it wasn't in existence in that practice already, is the ability for us to offer clinical research. Clinical research is critically important to community-based oncology practices. Many smaller practices cannot justify the investment. American Oncology Network will expand the scope of services that a practice can offer to their patients. But it's going to be such a tremendous advantage for these practices to be able to offer that. It allows patients to stay close to where they live, because in the past, clinical research has normally been only available at academic medical centers, which in many states may just entail one location. So patients, if they can't relocate for a period of time or travel long distances, they won't have the ability to participate in clinical research trials. The number of studies that we have is incredible, and we're very excited about being able to export that to practices. What's very exciting in our field, medical oncology, is the fact that we're now being evaluated on both the cost of care that's being provided and the quality. And so we've been offering value-based cancer care for really the last 4 years with various carriers, and it's something that we do successfully, and it will only continue to enhance the ability for us to provide the best outcomes for our patients. One of the other aspects I think that is very exciting for practices that join AON is the fact that we take care of all the administrative burden of running a practice day in and day out. The process of running a medical practice these days, especially medical oncology, in my nearly 30 years of practicing in healthcare, from an administrative standpoint, it's extremely complex and only getting more and more difficult. Whether it's HR, dealing with human resource issues, compliance, contracting with commercial insurance carriers, the government, trying to contract for drugs. We take care of that, whether it's revenue cycle functions, billing, information technology, legal, accounting, finance, managed care contracting, credentialing, compliance, overseeing the oncology care model. So it allows physicians to focus on taking care of their patients, and while at the same time it's also important, we still give a lot of autonomy at the local level. This is not a corporate-owned entity, and I think that's something that's very, very important. We're not owned by private equity. We don't have a third party that is having us be conflicted. We're on the same team with the physicians, but we give physicians in the local environment a lot of autonomy over decisions related to when they recruit physicians or not, how many physician extenders they have, how many employees they continue to keep their current compensation formula if they so choose. They continue to manage their vacation, their call schedule. Our organization gets paid on the incremental benefit that we bring to physicians. So our goal is to enhance patient care, bring additional services, but we don't get paid anything in terms of American Oncology Network unless the physicians benefit economically. Huge differentiator between us and some other companies similar to AON that are out there.